The amount of sleep we get can do more than just make or break the next day for us. Our sister network, the National Geographic Channel, is airing a documentary this weekend on the dangers of insomnia. According to one study, not getting enough sleep raises the risk of long-term health issues like heart disease, obesity, and even Alzheimer's disease. The CDC reports adults should get at least 7 hours of sleep every night. But according to one survey, about 4 in 10 American adults say they are not getting that kind of shut-eye. Dr. Carol Ash is here. She is Director of Sleep Medicine for Meridian Health. And you say this is one of the health epidemics, the prime health epidemics in the country right now.
John, there's been an explosion of this science, and it's really clear that Americans are not getting enough sleep, and it's a real public health hazard. It's one of the greatest, probably, epidemics we're facing.
And it's not just, as I said in the lead-in, it's not just that you feel a little groggy the next day or you maybe don't perform quite as well at work as you might otherwise. There are long-term consequences beyond that.
John, that's what we're really starting to understand. I mean, most people think of lack of sleep causing fatigue, but we're starting to understand, as you suggested, heart disease, diabetes, difficulty with weight gain, and some of the newer studies, which are really alarming, are showing that cancer will grow 2 times more quickly, and it's more aggressive and more invasive. And you know, it's not just behaviors. There's a lot of challenges that we have to getting good sleep. Like shift workers, for instance, firefighters would fall in that category. They can't get good sleep, and the firefighters, 37% of them have obstructive sleep apnea, which will limit your ability to get sleep. So
it's not just the number of hours you spend in bed. It has to do with the quality of the sleep you get while you're there.
Absolutely. It's the amount, but it's also the quality. And, you know, we're all looking at this whole Affordable Care Act and the wellness and our health. The Affordable Care Act really doesn't address these sleep issues. For instance, we don't really have good rest areas to stop off at on the sides of the roads when we're sleepy. There's no encouragement for cancer patients to see sleep specialists, and there's no national program to address school start times so our kids could get more sleep.
And there are a lot of jobs. I think of airline pilots as one example who have to work crazy schedules, and their sleep patterns are all over the place.
That's exactly right. And it's really taking a toll on all of us. And if we could just, you know, change some behaviors, you know, take a personal accountability to making sure you get the right amount of sleep and make sure the environment's quiet, you know, you want a cool environment and you want a dark environment so that you could sleep well. And if you think you have a sleep disorder, reach out to a sleep specialist so you can get some help.
I know that, you know, a lot of people, they might not do so well during the week, but they say, oh, I'll make it up this weekend. Can you do that? Is that possible? Does it help?
No, John, you can't do that. And in fact, what happens is when we try to meet all those demands and expectations, what we do, sleeping in, can actually offset your circadian rhythms. That has a whole new set of problems attached to it. So you really need to make the effort every day to make sleep a priority. It's that important.
And it manifests itself in all kinds of ways other than just, you know, yawning at your desk. People get irritable, they get cranky, and they're frankly not as good at their job.
That's exactly right, John. We tend to misread the cues of loss of sleep. You know, it happens very slow, but you can have sudden incapacitation if you've gone many hours without sleep. But it can cause you to have difficulty with depression, anxiety, impair your memory. You're more likely to have accidents. And if you have diabetes or heart disease, or if you're someone struggling with cancer, then you need to consider perhaps there's an underlying sleep problem and focus on it.
Wow. Some pretty sobering news there. Dr. Carol Ash, thank you.
It's a pleasure being with you.
Yeah. Go get some shut-eye, everybody.